Joining us now, Representative Bruce Westerman. Representative, thanks for your time today. We really appreciate it. How are you doing amid this COVID-19 outbreak?
I'm doing well. It's good to be with you. I'm glad we've got modern technology where we can do interviews like this, and appreciate you guys taking the time to visit with me.
Absolutely. We always appreciate your time as well. I want to jump right in here to a topic that lately has created a lot of concern and, quite frankly, some anxiety here in our state, and that is the issue of stay-at-home orders. Arkansas, pretty much the only state in the South that doesn't have some sort of shelter-in-place mandate right now. Should our state follow suit?
Well, I think you have to ask yourself what would change if we had a stay-in-place order. Are people following the social distancing guidelines now? What's the data showing us? You don't want to talk too much about positive results as far as the number of cases here, but the numbers are looking better than what we thought they would look like at this time. So I think we are seeing the result of some success as far as social distancing and people taking precautions. The governor has to make a tough call on that. I believe we're the only state right now that doesn't have an official stay-in-place order. But what would that mean if we had that? Because, obviously people still have to get out to go to the grocery stores, and you certainly don't want more contacts with law enforcement. So if we've got something that the public health officials say is working, that it's meeting the targets or exceeding where we wanted to be, then I think you have to ask yourself, why change that if it's working? But again, that's the call the governor will have to make, and it's something I will support him on either way that he goes on it. I think the governor's doing a great job right now, and the team that he has in place.
Certainly the state touting some positive results lately, but of course we don't know what that could look like in even just a week or 2 weeks from now. Dr. Anthony Fauci himself saying last night in a CNN town hall, looking at what's going on around the country, he doesn't understand why every state isn't sheltering in place right now. How much should we be weighing some of the federal thoughts that we're hearing from people like Dr. Fauci as well as the coronavirus task force?
Yeah, and again, we have to look at what's working and what works for Arkansas. We're different from a lot of other states. We have a lot of rural areas, and I have full faith that if the governor and the health officials here in Arkansas think that that's what's best for our state to shelter in place, that we will see that order. I mean, they've already had to make some decisions on closing state parks. We're seeing our national parks closed. But people are still able to get out and go to the grocery store and do those essential things. And, I think a lot of that depends on how well Arkansans follow the rules and do what's expected. But I do know the governor will look out for what's best for the state and our well-being. Our first emphasis has to be the health of our people, and then second, the economy. What do we do to keep the economy sustained? But we first and foremost have to do what's best for the health of our citizens.
I want to talk about our healthcare workers for a second, because here in Arkansas, almost 100 healthcare workers now have been diagnosed with COVID-19. Governor Asa Hutchinson at times voicing some frustrations that we as a state are competing, of course, with every other state when it comes to procuring personal protective equipment for our healthcare workers. What can be done at the federal level to make sure that our state isn't getting left behind?
And as you know, there is a federal stockpile of personal protective equipment that's being metered out by the federal government to places where they see it's most needed at the time. I think if we federalized all the PPE equipment, we would see even less coming to Arkansas, because somebody would look at the numbers here, they would look at the population of the state, and they would move more stuff to big urban areas. So I think our state's doing a good job in acquiring additional PPE, and we've got a lot of companies here. Right there in Fort Smith, you've got Pragco Lures who are making face shields now. You've got companies who are making hand sanitizer. You've got companies who are sewing gowns and sewing face masks. So Arkansans are really stepping up to the plate to fill in the gap where we're missing on some of these supplies. I know that dealing with the the Pharmacy Association, they were able to go into their members and find 54 ventilators that were sitting on shelves already here in Arkansas that hadn't been accounted for yet. So there's a lot of work being done. Arkansans are really stepping up to the plate to help with that. And I honestly don't think the system would be any more efficient if you tried to federalize it and have the federal government take possession of all PPE and say who gets it, where it's going to be distributed, and where the priorities are. I'd a lot rather have the governor and the state in control of that.
You mentioned some of the private enterprise, some of the individual corporations helping out in this time. Just today, L'Oreal committing to provide Arkansas with quite a bit of hand sanitizer every week. Where would we be if we didn't have this type of support from private industry? Could the federal government even keep up with the demand we're seeing right now?
I mean, it's hard enough to keep up with the demand with private industry pitching in. So no, without private industry pitching in, I think we would be in a much tougher position. And, I said that the two main priorities are the health of our citizens and our economy. But the third thing that we have to look at is what can we learn from this? And one big lesson I hope we've learned is that we have too much dependence on foreign supply chains, especially supply chains coming out of China. And there are certain products, pharmaceuticals, PPE, and other things that are critical to our supply chain that I think we're going to have to do a really good reassessment of that and come up with better policy once we get through this storm and can focus on those kind of issues again.
Of course, the other side of this health crisis is what it's doing to the economy. You all passed the CARES Act recently, sending individuals $1,200. When can we expect to see those checks coming in?
The checks should be going out within the next 3 weeks. If you use direct deposit, the money will go directly to your bank account if that's how you've been filing your taxes. We've gotten a lot of questions on that the past week or so. Right now, the focus, as far as the CARES Act goes, is the issue with what's called the Paycheck Protection Plan, the PPP. This is for small businesses under 500 employees who are trying to borrow money that would be forgiven to pay salaries and some business expenses. That's all launching today. Got a lot of problems with it. Like everything else, it's kind of flooding the system, and there's more people trying to access it than there's capacity in the system to use it. But was on a conference call with Secretary Mnuchin this morning. They're trying to work through the bugs on that, just like with the unemployment system. The state of Arkansas is seeing a factor of 30 times the number of people trying to access the unemployment system from what they typically see. It's going to take some time to work through the bugs, but people are working around the clock trying to get these programs in place and get people the economic relief that they need during these times.
Yeah, I want to talk about those unemployment numbers here in just a second, but it's April 3rd, bills are due. This $1,200 for individuals, for most individuals, probably not enough to help them pay all the bills for a month or even more than a month. So is it enough, or is more going to need to be done?
Yeah, and again, this is a one-time payment. It's $1,200 per individual. If you're a couple filing jointly, then you could get up to $2,400 if your income's below $150,000 a year, plus $500 per child under 17 years old. So it's actually more than just $1,200 for a family, but for individuals, that's the most amount, unless you also have dependents. You could claim more there as well. I mentioned the unemployment insurance program. That was part of the CARES Act, was to put more federal money into the state's unemployment system. So you certainly got that program out there, which is become a very generous program, possibly even too generous, with workers able to get as much as over $1,000 per week on unemployment with the federal match on it. But that's only good for I think through the end of July. And then the small business loan program is really designed to give employers funds so that they can keep their businesses open, they can pay their rent and expenses, and also pay their employees and employees not have to go onto the unemployment insurance system. So, really some robust funding and mechanisms out there to help people get through this on the economic side of things, but it is taking some time to get it off the ground and get everything implemented. So I hope people will have patience with that.
Do you think we'll need a, so to speak, phase 4 relief bill? And if so, what do you want to see in it?
I think we've got to see how what we've approved so far is working. That we're on the third bill. All the programs from the second bill haven't been successfully implemented yet. So we need to get these plans in place. There's a lot of input that I get and members across the country are getting that we're feeding back to the Treasury Department, Small Business Administration, and to other parts of the administration, trying to help them get the implementation of this as successful as possible. But I think we need to assess where we are. And it may be that we just need to put more funding into some of the programs like we've already got out there. This Small Business Administration loan program with the forgiveness component, I believe it's funded at $380 billion. There's concern that we'll reach that cap sooner than later, but if that program works well, we may need to put more money into that program. We may need to do more on the unemployment side. But this all ties back to what we're doing on the healthcare side as far as more testing, more analysis, trying to figure out where we are on the curve, if the infection rate's below 1, if we're certain that the healthcare system can handle the number of people that will be needing it if Americans go back to work. A ton of considerations into these decisions, and it's all dynamic and interrelated. So it's a lot of analysis that needs to be done. And the economic stimulus or support is right in there with all those decisions based on healthcare as well.
Let's get into those unemployment numbers a little bit. We saw the first-time weekly claims at 6.6 million last week, about 27,000 of those here in Arkansas. How bad do we think it's going to get for our workers?
Well, it's going to get worse, obviously, than what we're seeing right now. The irony here is that a month and a half ago, we had one of the best economies we've ever had, some of the lowest unemployment rates. And, this just, I think, goes to show the frailty of man and man's ways, that a little tiny virus that nobody can see is wreaking all this havoc, not just in the United States, but across the whole globe. It's death and destruction and economic turmoil. But I also think that the underlying strengths of our economy is still there. And the sooner we can get through this storm and get people back engaged in their businesses and in their employment, that the economy will rebound. But, if we lose lives in this, we can't go back and get those lives back. So that's why we have to first focus on the health of our citizens and do what we can to stabilize the economy so that it can come back and hopefully come roaring back.
You mentioned the low unemployment rates we've been seeing a month ago, 3.5%, some of the lowest rates we've seen in decades. But then today, the monthly report out, that number's jumped almost a full percentage point in just a single month. Can we realistically expect a quick bounce back once we get past this health scare?
Well, that's a bit of an unknown, but what we want to do is minimize the damage as much as possible so that it can rebound as quickly as possible. Again, the underlying strengths of the economy are still there, I believe. The longer that that it takes us to get through this, the more damage that can be done to that. It could possibly take longer to rebound than it's taken to get to wherever we're going to end up, where the economy ends up bottoming out. But all measures that we have available are trying to be implemented so that we can minimize not only the health concerns but also the economic impact of this pandemic.
One thing that stood out to me were the number of jobs lost, specifically in the healthcare field. About 43,000 of them, a lot of that likely due to things like dentist visits coming to a halt. But how concerning is that loss in healthcare jobs right now, considering the problems we're facing?
Yeah, this may seem counterintuitive to people that we're in a pandemic and people are losing jobs in the healthcare sector. and that's because that elective procedures are being delayed right now. So you've got clinics and hospitals and a whole sector of the healthcare industry that's really been stifled along with everything else. And, you know, a lot of this aid in the economic support system is going to healthcare workers. We've got rural hospitals in the 4th District and across the state that are experiencing some really troubling times. So we've got to do what we can to keep those hospitals there active and operating and keep them financially sound. So you mentioned dentist offices, ambulatory surgery centers. The list goes on about healthcare providers who are suffering just like everybody else through this.
Your district does span quite a large part of the state, a lot of rural areas involved in it. Some concern out of those areas about the ability to get tests. Are you concerned that maybe the testing capabilities that we have aren't reaching some of the more rural areas?
Well, the testing's improving every day, and if you look globally, the United States has tested more people than anybody else in the world, and we're the ingenuity here. We've come up with new tests that they're talking about, you know, 5 to 15-minute wait times on getting results now, but it takes time to produce those tests in mass. So I think the testing issue is working itself out, and we're going to be able to do a lot more testing, and that allows us to get a much better grip on the statistics on this pandemic, to know where we're at, what we're facing, and where we're going. So that the testing is critical. There was large sums of money put into the testing and also the therapeutic programs in the federal legislation packages that have been passed. So, you know, we're really hitting that hard. People all across the country are working on it, and hopefully we will get a vaccine at a rapid pace, and we will get some therapeutic treatments for this at a much more accelerated pace.
Okay, that's all the questions we have for you tonight. Representative Westerman, we appreciate your time.
Well, good to be with you, and let me know anytime I can offer some input.
Will do. Take care.